Hello everybody and welcome back. This is Dr. Mridula here. So it's quite hilarious, so many times when patients come and then they sit here and I say, okay, let me examine the eyes and everything. The first thing they tell me is, doctor, I'm in a little bit of a hurry. Please don't put those drops where, I'm not able to see for the next 4-5 hours. Well, let me tell you now, majority of the time I make it a point that it is very essential to actually get a dilated eye evaluation done, because it is very, very important. And let me tell you why it is important. So when we are dilating your eyes, we get a clear view of the retina, optic nerve and the back of your eye. Okay, now this is not possible if you do not dilate your eye. And why is it important is because when we dilate your eye, there are certain conditions that we will be able to detect very early on. See, for example, like a glaucoma, where that is a condition where there is an increase in the eye pressure and this can cause a damage to the optic nerve. Or say there is a retinal detachment where there is a separation of the retina. Or say in case of diabetic retinopathy, so when your sugars are highly uncontrolled, there can be certain bleedings which can occur inside your retina. Or say if there is some macular degeneration, or even high blood pressure can actually have some effect onto your retina. Even when we dilate your eyes, we can have a complete evaluation about certain cataract changes inside your eyes. Now this will not be possible if we do not dilate your eyes. In fact, some of these conditions will not even show any early on symptoms. Like your eyesight, if you check, it will be absolutely fine. But only when we dilate and evaluate the retina, we will actually see all these changes. And once we see these changes, if we pick them up immediately and start the treatment immediately, then you can really save your eyes. Okay. The other thing is, if you're somebody who is looking to change your glasses or you want an accurate glass power prescription, then dilating your eyes is necessary because then it kind of relaxes the eye muscles and we get a more accurate reading. Okay, so these two are the most important things why we need to dilate your eyes. One, to get a correct refractive error so that you can wear glasses with the right prescription. Second is to evaluate the retina, the optic nerve or any underlying pathology so it can be picked up early on and treatment can be started. I know when you dilate your eyes, it can get a little blurry for the next 4 to 5 hours depending on the type of drops that you're using. Some maybe for 4 hours, some even for 24 hours. And you might find it a little difficult to see nearby things. You might have a little glare while driving. Yes, all those discomforts will be there. But then you don't get it done very frequently, right? So at least when you're getting it done, make sure you dilate your eyes and get it thoroughly evaluated. Okay? Think about it. Take care.